Welcome to the recording of the online Green Party of New York Forum, originally broadcasted on Monday, April 28th, 2025, New York Health Act 101. In this session, you'll learn about the New York Health Act, which is an active bill in the New York State Legislature that could radically transform healthcare access by guaranteeing comprehensive, high-quality healthcare for every person living and working in New York, regardless of income, job status, or immigration. This is led by Dr. Daniel Lugassy and Gloria Mattera, who is the co-chair of the Green Party of New York.
But tonight we're going to hear about the New York Health Act. Some of you may know about it already. If not, you're going to get a little kind of introduction to it. But it is also a campaign that has been going on for a while that the Green Party of New York has been an early sponsor of, and we have been part of the lobbying and promoting about pretty much with the single payer statewide health insurance program. I'm delighted to introduce our speaker. Danny Lugassy is a ER doctor that I met when we were working in the same hospital together and had lots of political talks. And then he joined the Green Party some years ago. And it's been really a great inspiration for us to really learn about healthcare and the other social justice issues it connects to. So I'm going to turn it over to Danny.
Thank you so much, Peter and Gloria, and it's great to see everybody here tonight. Again, Danny Lugassy, he, him, I'm an emergency medicine physician, working now in several different emergency departments around New York State, New York City for over 20 years now. And I joined the Green Party in 2012, actually, when I was very involved with Occupy Wall Street and seeing how the Greens were coming to the forefront and pushing back against, really, we can talk about later, I think the Affordable Care Act was as obstructive as it was helpful to this movement. So tonight, and I'm going to show my slides here. Just a quick thumbs up if folks see that okay and still hearing me okay. Thank you, Jeff. Thanks so much. Good seeing you, Jeff. So I'm going to focus tonight on the New York Health Act, which is a state single payer bill, which if you haven't heard about it, it's not a surprise because as many things that are progressive and would really radically transform our society, we don't hear about it much in mainstream media and other areas. So I would later encourage you to take a peek at Gloria and I did a presentation on Medicare for All and the larger movement across the nation for universal health care. But again, tonight we're going to focus a little bit more on the New York Health Act and what's happening in New York State. So, as Gloria mentioned, the Green Party platform has been a supporter of single payer for many years, as well as the Green Party of New York being a prominent co-sponsor and supporter of the New York Health Act. So, as many of you who maybe have heard me talk before, I always start with at least one story, if not more than one. So, I've told the story many times, but it still gives me chills. I was working in a busy emergency department one night, seeing 40, 50 patients in an 12-hour shift that I usually do. I was handed an EKG, and I don't have anybody out there that can read this EKG, but this EKG is a massive heart attack. So once I'm handed this EKG, I run over to see this patient. It's a 58-year-old woman. She is clutching her chest. She's sweaty. She's pale. She's having the quote big one, a massive heart attack. And in the emergency department, this is obviously one of our emergent things that we care for. So you start to see a swarm of doctors, nurses, patient care techs surround her. We're putting in IVs. We're giving her aspirin. We're calling the cardiologist. And in the first few minutes, in the middle of this, she yells, "Stop!" And she points at me. She says, "You, get me my cell phone. You, get me my insurance card that I just gave the clerk. I want to know, how much is this going to cost? I want to know, is the cardiologist in network? How much is this going to be out of network? What is my copay? What is my um, co-insurance? All of this really just crazy stuff came out. And in those moments, I can tell a patient that I want to care for them and make sure that they survive whatever is happening to them. But you can see, and you probably know yourself or your loved ones or your family or friends have had moments where they're facing medical catastrophes and they're more concerned about how much something is going to cost. So for about 40 minutes, I'm going to talk about the New York Health Act, and then I want to open it up to you folks. I want to get the questions from you, and Gloria and I and others are going to answer things about the New York Health Act. I want to hear maybe what folks think about strategy, specifically within the Green Party New York, and then we'll talk about some closing and next steps. So I'm going to detail why we need the New York Health Act. Hopefully, most of you probably already know why we need universal health care, but again, I'm going to bring the focus back to what's going on in New York State. We'll talk about the New York Health Act, very simple, how it works, how it will be, how we'll cover folks, what's the cost. We're going to talk about the current co-sponsorship in New York State in the Assembly and the Senate. We're going to hear a little bit about the Lobby Day effort in March, which the Green Party of New York was a co-sponsor and I attended as well. And we're going to talk about how you can advocate for the New York Health Act with Greens in New York. So why do we need this? Well, we do need to zoom out just for a moment, and I'm going to highlight some of the really travesties of our U.S. healthcare system, and obviously it starts with the cost. When I talk about premium, copay, deductible, coinsurance, I just want to put us all on the same page. The copay is the amount that you pay when you go to visit the medicine doctor, the specialist, go to the emergency department. That comes out of pocket. Your deductible is the amount that you need to reach annually before your insurance company starts to pay. Your coinsurance is how much they pay after you've paid your copay and deductible. So it could be anywhere from 50% to 80%. And then your premium is the thing you pay each month. That's like the gym membership. We often talk about it. You pay that on top of all of these other payments. So when I got into this work 25 years ago as a first-year medical student, we were talking about how insane it was that the U.S. healthcare system was over $1 trillion. Now we are reached over $4 trillion on annual spending on U.S. healthcare. Again, 25 years ago, we were talking about how outrageous it was that a family of four average premium coverage for healthcare was about $7,000. That also has continued to skyrocket, and it's about $25,000 over the last couple years. The deductibles, meaning the amount you pay out of pocket after your premium, has gone up and up and up. I didn't even realize a few years back that there were deductibles of $3,000 or more. And what we're seeing right now is about half of the US population has a deductible over $1,000, and we're even seeing some folks, about 16% in latest numbers, have a deductible of over $3,000, which is absolutely insane. You've seen this slide before in many different ways. You know that we spend about 18% of our GDP on healthcare. And when we compare that to nations that have similar societal and financial structures to us, many Western nations, you can see here Canada, France, Germany, Japan, and others, we're spending 2 to 3 multiple times more on healthcare annually. And per person, we're spending over $12,000 per year. And again, that's 2 to 4 times many other similar nations. So what do we get for all of this cost, right? Well, if you look at the last 10 years or so, we've had a high number of folks who are just completely uninsured. Just a few years back, it was in the 45 million range. Now, the Affordable Care Act did address insurance, and that uninsured rate did drop. But I love this slide because it just leaves 2020 blank, right? If I asked all of you what happened in 2020, of course, the pandemic. And so what you see here is we don't know how many folks actually were uninsured during that year. There are some estimates of almost 40 million people that became uninsured during the pandemic. Because as you all know, your health insurance is often tied to your ability to pay or your ability to work. So you lose your job, you lose your health insurance. The latest numbers show we still have about 27 million people, or about 8% of our nation, completely uninsured. But the thing we have been following for many years since I've been in this single payer advocacy work is what we now call underinsurance. So you have insurance, but you either have to use 10% or more of your household income for out-of-pocket costs, premiums, right? Or if you're in a lower income bracket, using greater than 5% of your income, or your deductible is greater than 5% of your income. And when you think about this, you would think, wow, that can't happen to many folks. And it's staggering. In fact, a quarter of US residents are essentially underinsured. About half of us are insured all year, but about a quarter of us are falling in that bracket of underinsurance. Now, what else do we get for all of this cost? Well, as you've probably heard again and again, our life expectancy continues to drop when compared to other nations. Our overall health performance is quite poor. And in another talk, I can give you all that data, how we do in caring for people living with diabetes or stroke care. There's lots of different things that we are falling way far behind. But one stat that I want to give you that we often share is maternal mortality. So that is folks who die during childbirth. And in the US, about 21 people die during childbirth out of the 100,000 live births. Now, that doesn't sound like it may be a huge number, but when you compare it to other nations, it's actually 2 to 10 times more. And the reason we look at this is time and time again, the studies have shown if you have timely and easily access to healthcare and maternal access to prenatal care, you are going to survive. So this is a direct correlation to the lack of access that folks have in this country. You probably have heard this, but this is a study and it hasn't necessarily been repeated, but we had a pandemic that's going to show you something else. So the deaths due to being uninsured. So this is directly related to that uninsurance. At least 45,000 people die each year that's attributed to having no insurance. Here's, again, something that still sends chills down my spine. If we ever had an example of why we need a universal single payer system, the pandemic should have smacked us upside the head, upside down, and made us realize. And this was a study about a year in when there were about 1 million deaths in the United States from COVID. And the study from School of Public Health at Yale demonstrated that 1/3, over 300,000 of those COVID deaths could have been prevented in a Medicare for All type system. So not only did we do terrible compared to other nations in our COVID care, we could have saved hundreds of thousands of lives. And oh, by the way, we could have saved billions of dollars in that as well. They have repeated this study a couple times since I've been working on it in the last 20 years. And basically, they look at 16 industrialized nations, Canada, France, UK, other places, again, like us, and they look at mortality amendable to timely, effective care. Basically, can we save your life if you get the care that you need? We continually come in last in this race. Again, 16 out of 16 amongst industrialized nations. When it comes to healthcare access disparities, again, I'll share a link at the end of our video from the annual national meeting, but we have so many disparities within the healthcare system. And, most folks say, well, we have to separate healthcare from politics. But this is a famous quote by a physician that basically said, medicine is a social science, and politics is nothing but medicine on a large scale. And unfortunately, all of the ills that I see in our nation in politics and disparities play out in healthcare. I'm going to just highlight what happens in race and with the care of our immigrant community. So when you look at racism in the healthcare system, it is literally baked into all aspects, both how we interact with patients, unfortunately, and how our system institutionally and structurally perpetuates racism across its access and its delivery of healthcare. We talked about maternal mortality. Well, right here in New York City, our quote, progressive city and progressive state, the Black maternal mortality has been as high as 12% just a few years ago, greater than white counterparts. It's dropped a little bit, but it's about 5 to 8 times greater than white counterparts. And across the nation, it's still very high. The folks who are uninsured are more likely to be people of color. So when we create a universal healthcare system, we are going to address that healthcare disparity across race. When we look at what happens right when you walk into the hospital, and so this is a study that I often says has proved what I've seen with my own eyes working in different hospitals in New York City and Boston. And what they looked at is how would we be able to equalize the rate of Black patients and white patients that are going to academic medical centers or public hospitals. And what they found is what we call a medical apartheid. And so what you see is that 50% of Black patients would have to leave the public hospital system and go to the academic medical centers to equalize the rates. And we see these disparities between public hospitals and academic medical centers across folks who are uninsured and who are living with Medicaid insurance. And so you can see here, essentially, it's a 3 times different with Medicaid and 5 times difference if they're uninsured. And when you look at the academic medical centers, many of these centers, places that I've worked at, are right next to each other, but they have stark differences in the patients who are covered with Medicaid or are uninsured. As a son of 2 immigrants and the constant xenophobic attacks that are being perpetuated on our immigrant community, there are a few things to remember about immigrants. Number one, they make up 17% of the US healthcare workforce. So without immigrants, we would not be able to staff the hospitals, nursing homes, clinics, which we all know are already understaffed. And there is a vile myth out there that says uninsured, are a majority of folks who are undocumented, and that's why we're losing so much money. It's not true. In fact, of the uninsured folks that I've been talking to you about, only 15% fall into a category that are, quote, completely ineligible due to immigration status. So that's about 4 million people of the 27 million people that we're talking about in the US that are uninsured. Here's another dirty little secret. Over about a 6-year period of time from 2012 and 2018, and this study also has been repeated a couple times, non-citizen immigrants are contributing about $75 billion more into the Medicare pool, that financial pool of money that is used to pay for Medicare services, than they take out. In fact, it's the US-born folks who are taking out $100 billion more. So we forget that immigrants of all different documentation have their wages taxed. And that tax goes into our Medicare and other taxation systems. So they're actually keeping our Medicare system afloat. Please note that when we talk about healthcare in the United States, we often get mixed up. We talk about health insurance and healthcare. And I want to be clear that most of what I'm talking about today is just coverage and access and insurance. But that does not equal healthcare. In fact, what we have in the US healthcare system is we treat it as a commodity, something that can be bought and sold and traded, stocks and bonds on Wall Street. And that's not something I went into medicine to be part of. So in summary, in the US healthcare system, we spend more than any other country, we get less, we have poor healthcare outcomes, we have wide healthcare disparities, we don't cover everyone, and we have something else that is probably the most shameful thing that other countries don't have, and that's bankruptcy due to medical bills. I always show this infographic because I think it just tells a simple story. Almost 700,000 folks go bankrupt due to medical bills each year in the United States. When we look at Britain, France, Germany, Canada, Netherlands, it's literally zero. We live in a nation where if you can't pay your medical bills, we're coming after your home, we're coming after your car, we're coming after everything you have in the bank. And what is really also deplorable is that we know that of personal bankruptcies, medical bill bankruptcy essentially, or medical debt, is the primary reason that folks file for personal bankruptcy, usually accounting for over 60 to 70% of personal bankruptcies each year in the United States. Now, here is another dirty little secret that we don't talk about enough. The majority of people who file for bankruptcy due to medical bills and medical debt actually have insurance. 3/4 of them have insurance. In fact, 60% of them have private insurance when they get sick. So again, as I mentioned before, you get sick, you can't work anymore, you lose your job. Within a few months, you'll lose your health insurance. You're self-employed. You pay for your health insurance on your own. You can't keep up with the premiums, copays, deductibles. You'll lose that coverage. So having insurance, even having private insurance, is not something that will save you from medical bankruptcy. We have billions of dollars of debt across the nation. It's estimated over $220 billion total for all US residents in medical debt, and about 80% of them have over $10,000. So what about New York State? So I've talked about some stuff across the nation. So how do we compare? Folks often come up to me and say, you're lucky, you live and work in New York State. It's a progressive state. They have all these progressive values in New York City about healthcare and health insurance. And while they are that, there is some modicum of truth, you'll see, unfortunately, we're suffering as great as anybody else. So right here in New York State, we still have about 1 million folks who are completely uninsured. That's about 5% of our population. Again, you can see it's also disparate amongst race. So of those who are uninsured, about 3% are white, 10% of the Latinx, and 6% of Black and Asian. And again, to me, what it is so embarrassing that the highest rates of uninsurance are actually folks in the lower income brackets between $25,000 and $49,000 per year. This is a recent study that just came out about a month ago. They asked over 1,400 New Yorkers over a year's time about their worry and struggle affording healthcare in New York State. And over 2/3 of them said they basically worry about the affordability in the last year. And they have many different ways that they kind of elucidated this data. Essentially, 80% of them worry about cost of healthcare in the future. 2/3 admitted that they delayed or went without any care in the last year due to cost. And I hear this all the time as someone who works in the emergency department. We'll ask patients, why didn't you come in? You know, you had this injury, you had this chest pain, you have the abdominal pain, and they invariably tell us time and time again, I was worried about how much this was going to cost. In fact, those who are, again, in lower income brackets, those living with disabilities had a higher rate of going without care. So to me, this is the inverse of what our healthcare system should be doing. We should be caring for folks who are most vulnerable, not pushing them away because of cost. And what is interesting, when you look across party lines, the support for government-led solutions, which I will talk a little bit later about, especially in our Q&A, there's strong support for a Medicare for all single payer system. Here's what's really also interesting in this study. For folks who are making more than $100,000 a year, 75% of them were still worried about how affordable their health care was going to be. And it didn't really make a big difference if you were covered by private insurance, through your employer, on your own, if you had Medicare, if you had Medicaid. In fact, when you look at these numbers here, it was about 80% of respondents said that they were worried about affordability of their health care. It was the 75% who were living on Medicare. So again, Medicare has been cut and undercut time and time again. So it itself is not going to protect you from debt and medical bills. Here are just a few things that highlight how bad our medical debt issue is right here in New York State. So this was a study on liens on people's homes, right? So they can't pay their medical bills, so they put a lien on your home. This is a 2-year study, 2017, 2018. 56 hospitals had almost 5,000 liens on homes in New York State. This was at the same time that those 56 hospitals received over $400 million from what we call an indigent care pool. This is money that's supposed to go to hospitals for uncompensated care. If you haven't heard, hospitals sue patients in New York when they can't pay their bills, right? So this was a study, again, that looked over several years. They looked at 210 hospitals across all of New York State, including 5 state-run hospitals, 62 counties. There were 82 lawsuits, 80,000, sorry, excuse me. There were 62 counties. There were 80,000 lawsuits in a period of time where they looked at the nonprofit hospitals from 2015 to 2023, so about 8-year period of time. And this included also the data that they could look at for 4-year period of time for the state-run hospitals. So again, we're talking about 80,000 lawsuits across the nation. And what you'll see here is some of the counties that suffered the most were actually our folks who live in parts of upstate New York. And I'm going to highlight the county and the area in central New York right around Albany. I know we have our co-chair living in Albany, and we know that our state capital, where our representatives who are supposed to be working for us and improving our lives, when you look at what happens right around the state capital, 12% of Albany residents had delinquent medical debt. And again, what we saw here is this was bearing out across racial lines. So 10% of white residents had that debt, and 26% of that debt was held by people of color. And over a 5-year period of time, there were 5 nonprofit hospitals sued almost 3,000 people in Albany for medical debt. So if I haven't depressed you enough, I want to kind of turn the page and let's talk about the New York Health Act. What is it? How is it structured? How is it run? Where do we stand in the Assembly and the Senate? And what can we do moving forward? So again, just to remind you that most of us in our nation get our health insurance through our employer, about 56%, right? So you go to a job, they have healthcare benefits, you pay part of it, your employer pays another piece. We also have other pieces as far as Medicare and Medicaid make up the other big pieces of the pie, about 18%. And then obviously we have about 8 to 9% of folks who are completely uninsured. Right now, that system is very complicated. And I'm not going to spend much time on it because all of you probably have experienced the US healthcare system, and it's complicated, very high cost copays, deductibles, premiums in your own life, and probably have struggled with that. We all have. And in this very complicated system, there is a tremendous amount of waste. There's literal waste in the way we administer the system. So we have to hire people to figure out all the different co-pays, deductibles, premiums, and co-insurance for all the different plans, which there are thousands of, and there can even be hundreds of plans within one insurance company. There is a large amount that the public pays into our systems. We fund Medicare, we fund Medicaid. Some of our taxes actually go to private health insurance. The Affordable Care Act created a system where there were, quote, subsidies for people to purchase their own health care through exchanges. We should talk about that and what that actually was. That was actually taxpayer money used to help people buy private health insurance. So when we talk about single payer, and I do want to make it simple, and that's what the New York Health Act is based on. Basically, we collect taxes from businesses, employers, and people. That goes into one pot. That pot is then paid out to doctors, hospitals, prescriptions, etc. If it sounds very simple, it actually is, and it is that simple, and it's why we call it a Medicare for All system. In the Medicare for All system, we collect the taxes, and about 98% of that money collected goes back to paying for healthcare. So it runs at almost a 2% administrative costs. So when we talk about a single payer Medicare for All system in the New York Health Act, we're talking, number one, about removing the for-profit private health insurance industry. We're giving everybody universal and equal access for all the care that's necessary. And it's something that we're going to finally be able to control costs and spending. So you see here, I mentioned Medicare operates at about a 1 to 2% operating budget. When you look at the overhead for HMOs and other healthcare systems, you see it's anywhere from about 18 to 20 something percent. We have what's called 1/3 of each dollar in healthcare that is non-value added care. What does that mean? That is, again, all of the overhead, administration, and insurance profits. So about 31 cents of each dollar is spent on that. When we look at a similar nation in Canada, it's half. So we are spending a lot on waste. So what is the New York Health Act? It's actually a bill that was introduced by Assemblymember Dick Gottfried in 1993. So this isn't some brand new thing that just came out yesterday. It has received a lot of new support in the last 10 years, which I'm going to get into in a few moments. It is a state single payer bill that would cover every resident living and working in New York. So let me clarify that, living and working in New York State. We know that New York has a tremendous amount of folks who come from New Jersey, Connecticut, and other outer close regions to us. So in this system, we actually cover everybody living and working in New York State. Comprehensive benefits. What do I mean by that? It sounds crazy that I have to explain this, but you know, we often say we're reminding folks that your ears, your eyes, your teeth are actually part of your body. We all know that when we talk about health insurance coverage, we usually have supplemental plans for vision, dental, hearing, etc. This covers everything medically necessary. There are no financial barriers to care. There are no deductibles and no co-pays and no premiums. So no out-of-pocket costs when you go to see the doctor or go to the emergency department. How do we do this? The way we do this, it's quite simple. And I can bore you with all the details, but I'm going to give you the big picture and save the details for the Q&A. multiple studies time and time again, both in national single payer and specifically in the New York Health Act, not just for state single payers, but specifically for the New York Health Act, including this study by the RAND Corporation, which many of you know is a centrist leaning study think tank. They showed that we would save $45 billion a year when it was studied just a few years ago. We actually have upped that to almost $58 billion a year. About 90 to 95% of New Yorkers will spend the same or less on healthcare, and it would infuse over 200,000 new jobs into New York. How do we do that? By taking the private insurance industry out and removing the out-of-pocket expenses, we are going to be able to fund the New York Health Act and cover everyone. So here's a quick breakdown, because what I'm hoping some folks will decide after this talk is to jump in and get involved in the advocacy. So when you reduce the administrative costs, you save money. When you reduce the hospital and physician administrative costs, you're saving money. When you have one pool of all the patients, all the people living and working in New York, you actually now can reduce drug prices by bulk pricing and by bulk negotiation. We don't have that leverage when we're all into these 1,000 different plans. Yes, there will be additional costs, like covering everyone, like increasing the fees for hospitals and providers. Yes, the New York Health Act will actually improve on what is already reimbursed. So oftentimes we hear that Medicare and Medicaid don't reimburse enough. And that's why they're very restrictive. And no, not true. In the New York Health Act, we can actually bring that reimbursement up. The New York Health Act also, in the last few years, incorporated long-term care into the bill. That was something our allies were saying is missing, because when you're living in a nursing home or you have a family member who needs in-house long-term care, it's very expensive. So what you see is actually a net savings, even with the additional cost. So people still tell me, well, Danny, what about the costs? What's going to happen to the private health insurance industry? Well, number one, here's just quarter two, 1/4 of a year in 2019 and 2020. These are some of the top private insurers and the amount of money that they made in profit. Remember, 2019 and comparing to right smack in the middle of the pandemic. The United Healthcare Group doubled their profits during the pandemic, $6 billion in 1/4. But Danny, what about the cost? You just told me you're going to raise taxes. Well, this is very simple. Would you rather pay taxes into a system and then have everybody covered and you yourself covered and your family and your loved ones and never have to worry about medical debt? Or would you rather pay all those taxes into the system for Medicaid, Medicare, and then pay more into copays, premiums, deductibles? We should just call those taxes as well. So you might be wondering, okay, too good to be true. How are we going to pay for it? The bottom line is our current system is regressive. The status quo is the blue line here, and the New York Health Act is the orange. Essentially, what we do in the United States right now is health insurance premium is really charged regardless of your annual income. If you make $30,000 or $300,000, that premium essentially costs the same. It's what's negotiated between you and your employer, what part do they cover, and what happens with the negotiations with the insurance company. In the New York Health Act, what we do is the more you make, the more you pay in. So it is a progressive taxation based on wages as well as taxable income. So stocks, bonds, other dividends that will be taxed. And what you see is you have an effective rate that, again, It is a progressive taxation system. The more you make, the more you will pay in versus based on payroll and non-payroll taxation. So you might be asking again, well, if 90 to 95% of New Yorkers are going to pay the same or less, how does that work out? Well, what happens is you have to remember there's no copays, deductibles, premiums. So all that money that we're all spending each month or when we go to access care, that is taken away. We rather pay into the system, and then when we need it, it's actually there for us. So it's really that the top 5% of earners in New York State will pay a little, but sometimes close to breaking even. Now, when we look at who are the top 5% earners in the state, that's folks who are making over $570,000 a year. When we live in a state that has a median household income of about $75,000. So this is something that is going to be best for most New Yorkers. I'll share with folks who are here afterwards an email with links and other information about the New York Health Act. But what you can see here, and when we look at that effective tax rate, the more you make, the more you pay in. And many of us who have our employer-sponsored health insurance, the employers will be responsible for a minimum of 80% of that premium or that tax. So if you're making $50,000 a year, you'll pay 20%, which is about $690, and your employer will pay $2,700. If you're making $400,000 a year, you're going to kick in $16,000 and your employer is going to pay $66,000. And this is a payroll tax. Again, this is how we're studying it and showing that it is all going to benefit all of us, save money at the same time. Before we get into the Q&A in just a few minutes, I'm going to head off a few questions. Shouldn't we just cover the uninsured? What about the public option? The bottom line is the system only works when it covers everybody and gives everybody equal access. If we start cherry picking, let's cover the uninsured, let's create a public option, we're just going to continue to funnel people away from private health insurance, make it more expensive, and do exactly what these predatory corporations have been feeding on making money off of us for years. Can we do this without federal approval? We all have been following what's happening with the current administration. Yes, it's written into the New York Health Act. We can do this with or without federal waivers. We can roll over our funding that we get from Medicare and Medicaid, and the taxation system that I have described here, cover everybody and save money and infuse more jobs into it. Again, I talked about what's covered. You have the choice of hospital. So I'm just going to talk a little bit about what happened on the New York Health Act Lobby Day. The Green Party of New York, as you can see, our logo here in the bottom left. We were part of a large coalition. Over 200 folks traveled to Albany on Tuesday, March 8th. We were part of 15, 20 different lobby meetings. I helped lead this one for a senator who covers Brooklyn and Staten Island that has not yet co-sponsored the bill. I want to talk to you about where we're at with this bill. The current Assembly and Senate leaders for this bill are Assembly Member Paulin and Senator Rivera. And I'm going to talk to you a little bit about where we're at. Right now, today, the New York Health Act has 33 co-sponsors in the Senate. That's 33 out of 40 Democrats that we're still working on who are potentially going to sign on. The majority is 32, so we have the majority co-sponsorship for this bill. In the Assembly, over the last year, with a change in some of the Assembly in the 2024 election, we have lost a few Assembly members, and we now have 68 Democratic Assembly co-sponsors. 35 Democratic Assembly members have not signed on. 76 is a majority. But I want to tell you a little story about the New York Health Act and what happened in the last few years. About 10 years ago, there was an infusion and a reinvigoration of lobbying for the New York Health Act. And we were building up 75, 80, 90 plus co-sponsors in the assembly. But if some of you recognize, this was the former assembly speaker, Sheldon Silver. He repeatedly denied bringing the New York Health Act to the floor for a debate and vote. A few years back, around 2014, 2015, he was caught with fraud and a lawsuit and legal action, and he was kicked out of the assembly. Speaker Hasty was then placed into that role, and he immediately allowed the assembly to bring the New York Health Act for a debate and vote. We then easily passed the New York Health Act 4 years in a row from 2015 to 2018 with more than 2-to-1 majority co-sponsorship. So here's the disappointing part. We then in 2019 had a majority co-sponsorship in the Senate as well. And so for 4 years, we had what would have been called a Democratic supermajority, a Democratic governor, a democratically controlled Senate and Assembly, with both the Assembly and the Senate having a majority co-sponsor for the New York Health Act. And we have seen that the governor, Hochul, has been completely silent, has not said one word on the New York Health Act. This is even after the travesty and what I showed you happened during COVID. The current Senate Majority Leader, Stuart Cousins, seen on the right here next to Hochul, has also been silent and weak on this. They have not brought it to a debate to be allowed to be voted on the Senate floor, because we know essentially right now we can pass the New York Health Act on the Senate and Assembly floors, and then that would put pressure on the governor to sign off on it. Now, some of you might be thinking, well, didn't this happen in Vermont and fail? Yes, it happened in Vermont. In 2017, both the Assembly, Senate, and the governor signed off on a single-payer system. But any smear campaign that you have heard about why they did not then fully move towards a single-payer system and they abandoned their bill was really that conservatives and the healthcare industry came very hard, and the governor of that state, Governor Schulman at that time, really was embroiled in some legal battles, and his political career was going down, and he was very unstable, so he backed off of it. It was really the political will and the healthcare industry that came very hard at Vermont. You might be asking, well, what's happening in California? Don't they have a similar state single-payer bill? And they're in a similar situation with a supermajority Democratic leadership, both House, both Assembly, Senate, and governor. And I love this quote from Gavin Newsom, governor of California. In 2018, he was quoted saying, "I'm tired of politicians saying they support single payer, but it's too soon, too expensive, or someone else's problem." Well, guess what? He's continually backed off on it, and he has undercut the single payer movement there. They could pass single payer in California today as well if they had the political will, which for many of you who are on this call, you can see why I left the Democratic Party and joined the Greens to work on this, because they have at some point and many points in the 25 years that I've been working on this been some of the most obstructive to our movement. And I bring up California because California and New York cover a huge portion of the country. And if we get California and New York to pass single payer legislation, we are going to advance this cause tremendously. So now that I've highlighted, I often want to leave you with 3 things that I want you to do. I talk about believe, educate, advocate. I know sometimes we internalize this problem. We think this is a great idea, but it's never going to happen. I believe in single payer. I want to do what's best for my patients, but we are never going to see it in our lifetime. So we have to believe that things can change. I'm showing you signs to remind us that it wasn't too long ago that we had a racially segregated society. It wasn't too long ago where women weren't given the same right to vote. So we have to believe that things are going to change. We also know that many countries have adopted a single-payer universal healthcare system. In fact, in Canada, many of us look at it in the single-payer movement because they did this province by province. So maybe this is something we can accomplish state by state and then cover everyone nationally. We've had state single-payer movement. We have had state legislative movements like same-sex marriage, which again went state by state and then crossed the whole nation. There are many states that have state single-payer bills. It's not just New York and California. So this is a continued growing movement, and we can obviously be a leader. The second thing is educate. I'm here to educate. We're going to be starting a working group of the Green Party of New York around the New York Health Act. I don't want you to take my word for it. I want to share the materials for you. There's enough information out there that we can all be educated on this issue, be able to talk to our friends, colleagues, and also our legislators and representatives. The advocacy not only happens on the national level, but it happens right here in New York State. So we're lucky that we can both advocate for Medicare for All and the New York Health Act while we're working with the Green Party of New York. Greens have, again, as Gloria mentioned in the beginning, not only involved in the Medicare for All movement, but for many years have been strong allies and proponents of the New York Health Act. So a lot of what I'm going to talk about later and how we strategize and we work together is building your own story, talking about what happens with going to lobbying. But I want to just end with reminding folks that why I want the New York Health Act, why we should have it. It's really the only way we achieve a universal, comprehensive, high-quality, publicly funded healthcare program that is accessible to all folks living in New York State and working in New York. I'm tired of our system telling patients, you're not wealthy enough, you weren't born into the right situation, you don't have the right skin color, you live in the wrong state, you're not worthy. I went to medical school not to perform what some of us call wallet biopsies. I want to care for you when you come into the emergency department, regardless of your income or your health insurance. I don't want to ask you what type of insurance and how much money you have in the bank just in case you can't afford what's about to happen. We live in a country that has not addressed our wide income disparities. We know that poverty has hit this nation tremendously. In fact, many of you know, yes, in New York, we have a $15 minimum wage, which we know is not a living wage. And federally, it's still $7.25, which is embarrassing. And that's all while we don't even cover everyone for their health care. I believe that health care is a human right. It is a right of a civilized society, and it is something we can do for everyone right now. And I often end with this quote: of all the forms of inequality, injustice in healthcare is the most shocking and inhuman because it often results in physical death. This was said by the great late Dr. Martin Luther King Jr. And I know many folks like to quote him and use his name and likeness and the values that he stood for. And I believe in the things that he stood for. But again, I'm embarrassed to be part of a healthcare system that today in 2025, if he was alive, he would see is only worse than when he was alive. And I'm often reminded when we're talking about standing up and speaking for what is right. Here is a man who was assassinated, murdered for speaking words. So I thank you very much for taking the time to listening to me. So I'm going to shut off my screen. Thank you so much for watching this presentation on the New York Health Act. We hope that you'll follow these two local organizations, the Campaign for New York Health, which is dedicated to organizing around passing the New York Health Act, and as well as Physicians for a National Health Program, the New York Metro chapter,
This is the local chapter of the national organization that is dedicated to universal single-payer Medicare for all healthcare on a national and state level, and they are extremely active and an integral part of the fight for universal healthcare in New York State and passing the New York Health Act. We hope that you'll also follow us on all of our social media platforms, Green Party of New York. You can find us on Instagram, X, Twitter, Facebook, Blue Sky, and at our website, gpny.org. Thank you very much.